Good morning, everyone. Andrew Douglas in the Action News 5 digital desk. There is a new report on public health emergency preparedness, and it finds that less than half of U.S. states are considered highly prepared. It's kind of disturbing to hear some of these findings from this new report. Let's bring in Dr. Nadine Gracia. She's president and CEO of Trust for America's Health. Dr. Gracia, good morning to you. Let's talk about some of the key findings of this report here. My understanding is it's called Ready or Not Report. Tell me about it.
Yes, Trust for America's Health, we are releasing our annual Ready or Not report, which really assesses our nation's level of preparedness for infectious disease outbreaks, bioterrorism, and natural disasters. It also looks specifically at state level preparedness. And what we found in this year's report gives us actionable data to help policymakers at all levels, federal, state, and local, to be able to take steps to continue to improve their emergency preparedness. In this year's report, 19 states and the District of Columbia were in the high performance tier, 16 states in the middle performance tier, and 15 states in the low performance tier.
So, Dr. Gracia, we broadcast to West Tennessee, North Mississippi, and Eastern Arkansas. Tell me how this Mid-South area did in this report.
Yeah, so what we saw in specifically for Tennessee is that this year, it was in the low performance tier. It actually fell from the middle performance tier to the low performance tier this year. When we look at strengths for the state, one is that it has plans in place to be able to expand its healthcare capacity during times of emergency, as we've seen how hospitals have been stretched, for example, during the pandemic to be able to respond to the emergency. It also has plans in place, for example, around expanding its public health laboratory capacity. But some opportunities for improvement include one, the level of public health funding in state public health. And we've seen actually a decline and a decrease in state public health funding, as well as the opportunity for public health accreditation. Any state, even if they're high performing states, really have opportunities for improvement. We've seen that in the state of Mississippi, where they are in the high performance tier. And so there's opportunities really across the board in addressing both healthcare readiness as well as strengthening the public health system.
So tell me more about the criteria involved in this study where you're able to determine low, middle, and high state readiness or preparedness.
Yeah, so the report looks at 10 indicators that are closely associated to public health preparedness. Factors like being able to have plans in place to expand your healthcare capacity during times of an emergency, so that hospitals, health systems, for example, are able to have nurses that can come from other states, for example, to be able to help support the healthcare needs in that specific state. It looks at plans in place of the public health laboratories to be able to surge their capacity in testing during times of emergency. It also looks at factors like level of public health funding in the state, as well as issues such as paid time off. The number of employed individuals who are using paid time off. We've seen in the COVID-19 pandemic how critical that is. If someone is ill or needs to take care of a family member, having access, for example, to paid time off to be able to stay home and not, for example, coming to work where they might actually then spread an infection such as COVID-19. It also looks at accreditation, which either public health and emergency management accreditation, which really helps to assess the strengths and weaknesses of departments at that level and be able to have quality improvement to strengthen those areas and opportunities for improvement. It also looks at hospital quality as well and ratings of hospitals within the states.
I was just going to ask Dr. Gracia, these recommendations in this new report, is it going to be sent to some of the state leaders across various states, all 50 states, to talk about where they're strong, where they're weak, where they need to continue to work to be 100% prepared for any kind of health emergency?
Yeah, you raise a critical point, Andrew, which is the role that this report and the data and recommendations can have for policymakers at all levels, Congress, as well as at the state and local levels, to be able to take concrete actions that can help to strengthen public health preparedness. So indeed, we share this report broadly, certainly with congressional offices. We share it with state health officials and other state partners to be able to use this as a guide and understanding that it's a checklist to be able to serve as a guide, to be able to strengthen opportunities for improving public health preparedness. One is a key area is strengthening the investment in funding and resources for the public health system. Public health has been chronically underfunded for decades. There's also a severe workforce shortage as it relates to public health. There's estimated that we need about 80,000 full-time equivalent positions for state and local health departments to just even be able to meet the basic public health services. So these are some of the steps that policymakers at all levels, including the state and local level, can be taking to strengthen our nation's preparedness.
We have thousands of viewers who join us each and every day on the digital desk, and perhaps they're watching this wondering what they could do specifically to prepare themselves and their family for any kind of emergency. Is there anything that they can do right now?
Yeah, it's a great question. And one is always certainly to follow public health guidance, out of the local and state health departments as it relates to being prepared for and when there is an actual emergency, following that evidence-based, science-based information with regards to the response to that emergency, whether it's to an infectious disease outbreak or if there's been some type of weather-related emergency. One of our indicators is also about vaccination and specifically seasonal flu vaccines. As a nation, we are underperforming as it relates to our national targets of having 70% of the population that is vaccinated against flu. So there's every year getting that flu shot for people that are 6 months and older is a concrete way that you can also take steps to improve our nation's preparedness and your local community's preparedness as well.
Okay, President, CEO of Trust for America's Health, Dr. Nadine Gracia, we appreciate your time. Thank you for the conversation this morning.
Thank you for the time. Appreciate the opportunity.